Hello, hello, and welcome to the Balanced Mama Project Radio. We're excited to have you here with us today. Right now, this is Dr. Say, and I'm here with Dr. Val.
Hey everyone.
And we also have our special guest, Dr. Janvi. She has her doctorate in physical therapy. She is CAP and pelvic health specialized. She is the lead therapist of Bloom Wellness and a DC native. She specializes in pelvic PT and combines evidence-based care with personalized whole body approaches. She also dry needles, y'all. If you have not heard of dry needling, I won't say it's the rarest find, but it can be a challenge to find, especially someone who is pelvic health certified as well as completes dry needling. And then she does care with focus on exercise-based treatments, supports patients with pelvic pain, incontinence, and postpartum recovery through her practice. And she helps folks restore strength, function, and quality of life. And today, she is here to bring us some extra knowledge on what one-on-one pelvic PT can look like. Welcome, Dr. Janvi.
Welcome.
Thank you. Thank you for having me.
Yeah, we're so excited to hear you. Okay, or have you here. Okay, let's get started. Tell us. So today we're going to talk about the differences between one-on-one care and group care, virtual based care, that kind of thing, just to clear up some maybe misconceptions or considerations for people seeking physical therapy and what type of physical therapy they should be seeking, specifically as it's related to maternal health, of course, because that's why we're here. So tell us a little bit about what one-on-one pelvic PT looks like. What's a typical session like?
Yeah. So I think typically the way I like to run my sessions is I'll have someone come in and I'll take like a pretty detailed history. Like usually it takes like 20 to 30 minutes to kind of get all the info. I like to know everything. Like I like all of the details. So like what are we doing in terms of like exercise? How much are we peeing? How are bowel movements? How much water are we drinking? Like what are we doing to exercise? How are we sleeping? Like getting like a holistic picture of a person. And then from that, like, depending on what a person's coming in for, like if they're having pain, if they're having incontinence, if they are just like, I want to prep for labor, like, figuring what that looks like and then assessing their pelvic floor. And sometimes that includes like an internal exam to be like, what does your strength look like? How does your tissue move? How does it hurt if I touch it? Does it not? Like, are we feeling can I replicate your symptom? And then seeing like, all right, well, if once we sort of figured that out, like coming up with a plan, right? So if someone is like, ooh, there are a lot of spots that hurt, all right, well, how are we going to fix that? There are a lot of spots that are tight, how are we going to fix that? There's some weakness, what are we going to do? And that generally sort of takes up the entire first session of just like, it's almost like a treasure hunt of like, what is going on and how do we figure it out?
Yeah, absolutely. So it sounds like your assessments are a lot of hands-on things, which is what we do as PTs when we're in person with someone. We're doing a lot of hands-on assessments to see what's going on with the tissues and everything like that.
Yeah.
So when do you think, we can all kind of have a discussion about this, but when do you think hands-on care is absolutely essential? Like what conditions would actually require in-person support?
I think if there's like an actual impairment, like if you are like, I'm leaking or I am having constipation or my back like hurts, I think those are situations where it's like, there are exercises that can help, there are stretches that can help, and there's a tons of people that can like help with that. But if you've tried some of those things and you're like, that didn't fix my problem, like it's still there, like I can't, I'm not God, I cannot figure out your problem just by looking at you. I have to touch you and I have to check like where is this like problem originating from. And so if I can't get my hands on you, if I can't sort of like figure out like where that is coming from, then like that's I think where like hands-on is very necessary, because sometimes you can't talk through a problem because you got to feel.
hmm And I would add to that because I think that, there are some conditions where I think if it's acute, so if it just happened, I'm like, yeah, we can do some hands-on stuff. We can, work with you hands-on because if it just happened, there's probably not a lot of like
Long-term,
long
chronic
term,
patterns that have
yeah,
set into place.
chronic patterns, exactly, chronic and behaviors and things like that. But then when I think about conditions and things that have been going on for a long period of time, that often I think has so much of a neuro component sometimes, so much of a psych component, a behavioral component, that there are a lot of things that we have to unpack before we even get to, if needed, even get to that kind of tissue issue, because sometimes it has exacerbated past the tissue issue. So yeah.
Yo, I love all of the pelvic PT energy. Yes, definitely for the neural lens. Yes, definitely for some things are like I also liked how you mentioned, yes, like there are some exercises, yo, and it's not the YouTube. The YouTube takes me out every time when people come in and they're like, I've done my YouTube exercises. Some are great, but I'm like, well, what exactly did you do? Because I think there's some confusion into what exactly is going to be helpful and what's not helpful. And so oftentimes at least talking through with the specialist, like, hey, this is helpful, this is not. And from at least from personal practice, I've also seen, I think pelvic pain is one of those things that I think lends to being seen in person as well. Um, it can go either way, but I do like the fact that, yeah, some things, especially when it comes onto the urine leakage front, I've had quite a few people where I'm like, hey, like you're saying, if you do the talk through and it's more of a behavioral or more of a chronic pattern thing, those do lend well to
And
virtual.
speaking of that, it makes me think about the bladder diary and how we often start with the bladder diary with leakage and things like that. And so then it
Sinus
makes me think
prolapse.
about, and then it makes me think about like, half of it is, maybe not half, I should say, but part of it is going through that bladder diary and saying, okay, what are your behaviors? What are you eating? What are you drinking? When are you having this leakage? And some of that stuff can be talked out in
Yeah,
the beginning, but
yeah.
then if we're addressing those behavioral issues and okay, we're still having some
Still having some
difficulty.
things going on. Yeah.
Also, with some of this too, is like I think there's an element of like sometimes someone thinks that they're doing something correctly, right? Like especially if they come in, they're like, I'm doing all my core exercises, I'm doing my pelvic floor
And
exercises,
it's not.
and then you watch them do it, and you're like, no, you aren't though, right? And some of that stuff, like
It's
Yeah.
real
it,
strong.
Yeah.
I know
it's
you
not,
are.
yeah, it's not something that we like. I don't know. Up until now, like I'm in my 30s, no one's ever like been like, let me watch your pelvic floor. Like, are you doing a pelvic
Yeah.
floor contraction correctly? With
Right.
like a bicep curl, like yeah, I can like watch myself in the mirror and I know what that looks like and I can replicate that. And
Yeah.
sometimes it's like I don't. Am I breathe? Like, am I exhaling correctly? Am I like knitting my abs together? Like, I don't know if I'm doing that, and there's no way for me to like check that because if I try to look, I'm gonna mess up my form.
Right, right,
You
right.
know, like
Oh, yeah.
and
Yeah,
You
as a
know,
person, like
you
you
can't
can't,
look for you.
yeah, you
and
gotta have someone look for
that's
you.
like where in person I think is so helpful. And because like I have to like I can watch you. I can watch you and be like, "Hey, I get you are on the right path. You like figured this problem out for yourself, but you were not doing the actual moves correctly. Like let's address that and so that way you can help I can help you help yourself, you know?"
Yeah.
Yeah, and bottom line, I think people, we do have to highlight and shout out our profession. Like we are movement experts, we are movement specialists, and
Yes.
so that is what we do. We assess the movement, we look with our eyes, we assess our movement, we ask you questions. How are you feeling in your body? We get you to understand what it feels like to be able to move your body in the proper way, and we do it until it clicks for you. So I think that is the difficulty with people using YouTube. YouTube can be used as a great tool, especially if you know what you're looking for, and especially if you know how to modify and you know how it should feel in your body. Fantastic, go for it. But then it gets into like the self-diagnosing and the like being like, oh yeah, because I have this back pain, it's probably a
Slip
facet
disc.
issue, slip
Yeah.
disc, like
It's
right.
bulging.
And it's like,
Girl, it's
wait
the
a minute.
arthritis. Let me
Did
stop.
right, did anyone do a proper workup on you? So then it's tough when people kind of go along the line of like, I did all these YouTube videos for this particular diagnosis, but then it's like,
That's not your diagnosis.
And
that's
I'm
not
like, did it
it.
help? Because that's why.
Yeah. Did it help is a good question.
I
Did it
know
help?
I sound like a hater, y'all, but sometimes people are like, I've done all the things, and you're right. It's like, but did you do all the things correctly, or did you do the things that apply to what the actual issue is? Do you, Janvi, when you are in practice, do you often get a lot of people who come in where they've already self-diagnosed? Do you get a lot of people who are like, oh yeah, I've done the exercises, I know the Kegels are always thrown in there. I know they gotta be.
The
I know people are
Kegels.
like, I'm doing it, and you're right.
Oh,
50% of people aren't doing it correctly. So then
And
it's figuring out is it right.
absolutely. And I think also when people come in, sometimes they'll tell you they're like, "Oh, like my pelvic floor is really strong," and you assess it, and you're like, "Yeah, your pelvic floor is really strong. You were correct in that." But there's a core.
yeah.
There are hip muscles. There's glutes. There's inner
So
thigh
much
muscle. Like
body.
there's so many other things. And how would you know? You didn't go to school. Like
Mhm.
that's not what you're good at. That's what I'm good at. So like sometimes it's
Mhm.
like you need someone's help to be like, what else am I missing?
What else am I missing? Exactly, because nothing works just on its own or in a silo. Everything is working together in the
Yeah.
system. So we have to figure out what is going on in the system.
Yes, I do often tell people, yes, you know your body, but like you know how you feel, but when it
Hmm.
comes to teasing out what's going on, like that extra pair of eyes, and even it's so important when you talk about taking 20 to 30 minutes to take history, because I'm
Hmm.
like, there's a lot that can be laid out when it's like, oh, that's what you're doing, or oh, like that's what's going on in your everyday life, because a lot of
Hmm.
times those factors matter just as much. But I often think of
Hmm.
when I go to the car shop, am I a car expert? No. Do I care to be a car expert? Not at all. But
Mm-mm.
am I like, yes, please do my car diagnosis and let me know. And then I can say yes or no. I'm willing to do the things that it takes
Yeah.
to make the car better. I'm willing to either pay or not pay. I'm willing to try to drive around and let the tires go down, or I'm ready to get them like swapped out. And
Yeah.
so there's a lot to
Hmm.
be said with going to a specialist. And I don't, for the audience listening, no, nobody expects you to know all the things. And no, we're not saying that you can't Google. But also, please see someone. If you doing your YouTube program has not helped you,
Hmm.
please go see someone. And
Hmm.
maybe skip forward to seeing them instead of doing your YouTube program.
And I will also say too, I can't highlight enough going to see professionals as we've been like saying this whole time, right? But when you do go, for the listeners out there, it's so important to write down not only how you're feeling, how your body is feeling. You can write down how your whole being is feeling, and also keep a log of it. So it's not just on a like one day I felt like this and then one day I felt like this, but keep track of it. And then when you come in, then present that. We can work with a pattern. If we can see a pattern, it's also very helpful. Like when is this happening, right? Because that's going to be one of the questions that we
Yes.
ask you is when is this happening? And for some of our clients who we see for education based virtual coaching, a lot of times we'll say, okay, and a lot of times it'll be like a chronic kind of like, I've been lifting my kid for this many years
Yeah.
and I'm still having this issue. Then we'll say, okay, when is it happening? Is it when you're lifting them to put them on the toilet? Is it when you're lifting them to put the carrier in the car? Like we can actually work on how you're doing that to decrease that
And what does
pain.
it look like? Show
Yeah.
us what you're,
And
yeah.
show us what you're doing. But if it is something where you're just like, generally speaking, it hurts.
Yeah.
Then it's harder to piece out. We just have to do a little bit more digging. We can do it, but we got to just do a little bit more digging.
And I think actually also to that point, there's an element of like I at this point in my career have seen maybe 1,000, 2,000 pregnant women. Even like any random person on the street, even if you all of your friends are having babies and you've got a ton of sisters and sister-in-law, like you haven't seen 2,000 people, you don't know 2,000 people. Like I've seen like more
Yes.
people than you, and
Yeah.
I can pattern recognize better than you and faster than you. And like, why waste time? You don't have a ton of time. You have a baby. Like,
You don't have to waste
Yes.
time. You can see someone who is certified and licensed and all
yeah,
of the things. Yeah, yeah, for sure, for sure.
To that, I would say yes. When can that generalized programming, generalized advice fall short? Like when people are
Hmm.
like, oh, I've gone through birth, so I can tell you
I would say
how
like
to birth.
when can it I feel like it's like when can it be good and when can it be
Oh, I like that.
maybe
Not so
not as
helpful.
helpful. Yeah,
Yes,
yeah, yeah.
helpful and not helpful.
Uh-huh.
Because you're right,
Hmm.
there is some value, but there's also challenge. Yes.
Yeah. The different well go ahead, Javi.
I think the value with that is that sometimes I think especially with groups like the kind of groups that you guys run, like is that sometimes it is nice to experience something with someone else. Like if someone is
Hmm.
like in the newborn trenches, if someone is like learning how to deal with a blowout diaper, if someone is learning how to like breastfeed, or like if they're learning how to be a parent, like even someone who is like 6 months removed from that, like they don't remember in the same way that you do when you're like
Hmm.
actively in it. And it's
Hmm.
nice to be like, I'm not alone. There are other people who are going through this at the same time as me and having the same struggles as me. And like I think that's very mentally grounding of like I everyone else is going through this too. Like this is not unique to me. I am like one of many. Like if they can do it, I can do it. Like I have a friend. Like I think that's very important.
Yeah, yeah,
But
the
also
social aspect of it.
yeah, but every body is also different, right? Where it's like
Hmm.
they might have had a C-section, you might have had a vaginal birth, and it's like you're now it's the same thing. You both have a baby.
Exactly.
Yes.
And that I think is why, so we got a lot of feedback. We did a listening tour in the very beginning of us developing like our programming and stuff, and we got a lot of feedback on some of the groups can be helpful, but it's tough when everyone seems to just be sharing and sharing tips and sharing, it sometimes can feel overwhelming or it can feel whatever. And
Yeah.
so some of the feedback was like, I would have loved like a almost like a mediated group or like a
Yeah.
moderated group, something where, we can share, but then there's someone who has some evidence based or some background knowledge, some expertise on things to shed light on it. Um, and so we try to promote an environment where there can be sharing and there also can be knowledge sharing as well to supplement or even enhance what is the experiential learning or experiential situation for these mamas. Because I think it's valuable to have that short storytelling and that sharing, like you were talking about, Dr. Janvi. And it is also valuable to be like, okay, that is your experience. I understand that you have a different experience. Here's maybe what the is happening in each of these bodies that it might be different. You know, so in every single pregnancy, every single baby is going to be
Postpartum.
different. Every
Yeah.
single postpartum experience is going to be different. Yeah.
I think that speaks a lot to when you said moderated group, that speaks a lot to the importance of having that extra guidance or at least having that input. You're right, experience means a lot, but the guidance itself, where it's like, yeah, I hear that that is your story. That's probably not everyone else's.
Hmm.
And like you said, this is where it's similar, this is where it's different. And not
Yeah.
fear mongering. No
Yeah.
fear mongering.
And I think too, it's important to be able to highlight like this was my experience. A lot of times people might share a negative experience and it is under the guise of wanting to make sure that people are aware that this could be the case or this could happen or to be aware of some signs and symptoms. And that's a lot of what we do too in our education based virtual coaching is share things to consider without saying this has to happen to you or just because this happens to X percentage of people that this will happen to you, and just really highlighting that everybody is going to be different.
Yeah. And that there's ways to address it. It's
And
like,
there's
this
ways
can
to address
happen.
it.
And
These
there's
are
ways to
and
address it.
these are tools that we can use. Yes, 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 absolutely. And this is how to address it. Absolutely.
What are just shifting the lens a little bit? What are some of your favorite things about working one on one in that maternal health space with folks?
I think it's so fun to like just like get to like yap. Like if we're being honest, like my favorite part is like getting to just like talk to someone. Like and I think especially I find that like when people are coming to you like during their maternity leave, like before they go back to work, like you were maybe other than like their partner or their mom or some family member, like you were the only adult that they're talking to on a regular basis. And it's really like to be part of someone's like you see them more than they see their friends. I see them more than I see my own friends. Like to be
Yeah.
someone's friend for a little bit and be like, tell me about your life and tell me about how like what you saw this TV show. Like what did you think? Like that part is so like to bond with someone in that way and to be like, if they're like, this is really stressful and I haven't slept for 4 hours, like, okay, cool, like let's talk about it. Like let's just like yap about it a little bit. Like and for them to like just whatever they want to talk about, whatever they want to tell you, like you're like, I am here to listen,
Yeah.
like without any judgment, and like we're still gonna exercise and I'm still gonna make you work hard, but Like,
Yes.
you can talk about whatever you want to talk about while we do that.
Yeah. Well, and to that point, I think I love it too. And I mean, I've been invited to many a cookouts because I've become close with
Yeah.
my moms that I see. But I think with that, your services are one-on-one, and they're also not tied to insurance, and neither are ours. Our services are also not tied to insurance, and I think that lends itself to both of our services being able to have those conversations,
Have the time
have
and
the
not feel
time.
rushed.
And I strongly believe also in, the impacts of social determinants of health and the impacts of your entire being on your health and your wellness. So as we're talking, like, there's some of my moms where, they'll be like, oh, I'm not getting sleep. And of course, in the typical I'm a new mom, not getting sleep way. But then, they'll say one thing and it's like, oh, that might be, maybe we need to look into that a little bit more. And so then we're talking about what other adjunct services might we pull in. Maybe we need to onboard a mental health service, a
Yep.
mental health therapist into our care team, or maybe we need to talk to an endocrinologist because you were mentioning X, Y, and Z, right? So having those conversations, it's not necessarily just us like chit chatting, although it feels like it, but it also is us being like, oh, what else is underlying with this? Like, you're saying you're feeling despair. Wait a minute, you didn't say that last week, or we didn't, you weren't talking about that before. Okay, let's piece that out a little, parse that out a little bit. So, yeah, I love to be able to have the freedom to care for individuals, for groups in the way that maybe being bound by insurance doesn't exactly allow us to do.
And quick tidbit on that, I think that this is something maybe to consider even when picking a provider when you're like, I love to yap. And I'm like, yes, I think all of us are like, and not saying it's a must, but I
Mm-hmm.
think a lot of times, at least when I meet other maternal health, pelvic health providers, we're chatty patties and
Mm-hmm.
not saying we're divulging our whole life, but we want to know what's going on. We want to know the details. And I'm like, when finding a provider, especially for a personal space, I think it's something to heavily consider if it seems like your provider. And I don't want you to be like, does my provider enjoy working with me? But is your provider providing that space where you can share what's going on, where you feel not like, oh my God, I'm going to therapy. Or if you do feel like, oh my God, I'm going to therapy, once you get there, you're like, oh, I'm glad I went. Like, I'm glad I got to talk to you. Did I
Mm-hmm.
want to do 90 exercises? No. But did I get to share about my life? Were they invested? Did they tell me extra information based on what I'm sharing? Because you're
Mm-hmm.
right. It is like, yes, it's a nice social, but also it's like an investigation of, is there anything else that's being missed? Because if you're not talking, then it's like, okay, you can do these things, but if other things are going on in life,
Mm-hmm.
sleep, diet, hydration, all of these things are in your everyday.
Mm-hmm.
Socially, like,
Mm-hmm.
are you isolated? What's going on? There's so much to be said. And so having someone that allows you to feel like you can share is so important.
Mm-hmm.
So ladies, I guess we kind of touched on this, but I was gonna say, why do we think moms need support just beyond the physical body? Why
Mm-hmm.
is nervous system support really critical in recovery as well?
Mm-hmm.
I think the pelvic floor is a nervous system. Like, I mean, it's controlled by the nervous system. Like, it's not just a muscle. Like, it is
Yes.
like heavily controlled by the nervous system. So to ignore it is to just do half the work,
Yeah.
and that's not correct.
Oh, I like that.
Mm-hmm.
Yes.
You well said.
It was.
Well said. I mean, I start off, we are such a neuro nerd, but outside of
You
that,
you are, my friend.
I'm such a neuro nerd, but I start off with parasympathetic nervous system activation. We start there because I believe that that's the foundation, right? I believe that even if we do 1,005 exercises, if you are holding tension for stress related reasons or you're not able to relax, half of it is you being able to coordinate your relaxation and activation. But a lot of times it's even just bringing awareness to the area, which then takes a lot of nervous system regulation and resetting and understanding and tapping into it. And so a lot of breath work, a lot of movement that coordinates the body first and foremost. And a lot of times too, people will mention feeling disconnected from their bodies, especially during the time of pregnancy and postpartum. So being able to reconnect first before throwing a lot of, different exercises, I think is very key. And then also, when I was mentioning earlier, like the social determinants of health, research has shown that 80% of our health is determined by those factors, and then only 20% is determined by what you do in the doctor's office and treatments and medical interventions.
Yeah,
And
yeah, yeah.
with that being said, it's like, no, what is your environment like? Is it loud all the time where you're living? Do you have any peace and quiet? Are you experiencing any food insecurities, or is, food scarcity something that we are needing to work on? And like just diving into lots of different conversations with folks, I think can really like first address that fight or flight sense that maybe a lot of us have anyway on a daily basis. But it's sometimes, a lot of times people will say like, oh, my session with you guys is just a respite, like a
Yeah.
Totally.
rest period. I don't get to lay down for a second in my day, but I get to do it in this session. And so
That's true.
it's nice to be that comforting home, I guess.
Yeah, no, absolutely. And I think also like especially like when we were talking about earlier of like, doing the YouTube stuff, like I think you can learn a lot of the physical stuff, but if you don't do what you're saying of like connect the pelvic floor, if you don't like find that like nervous system connection, do the parasympathetic work, like you're not going to get better. And I think that's also where like the training comes in of like how much of it are we supposed to do? Because like if breathing is like I'm alive, I know how to breathe,
Right.
like
Yeah.
Right.
but how do I do it to like connect my pelvic floor to my body? How do I do it when like I'm trying to lift my baby up? How do I do it when I'm trying to like do some of those things? Like that connection is really, really important, even if the actual like physical, like what you're doing is something that you absolutely already know how to do.
Yeah. But are you holding it, right? Are you
Yeah.
holding your breath during the day and therefore clenching all the things, like bringing awareness to it doesn't even necessarily mean changing it, but just actually noticing, am I holding it? Am I shallow? Where is my breath right now?
Yeah, and even because someone knows how to do it, like I've known how to do a number of things in my life, but again, doesn't mean I've been doing it properly because we accumulate movement patterns to protect, like the body's gonna get the job done. However, it needs to get the job done. So if it's like, oh, it hurts, let me move in this weird way and create a new pattern to get it done, it's still gonna get done. So yes, I can do it. Yes, I know how to do it, but am I doing it in a way that's going to allow my body to feel better? Because right now, probably not. That's why we're here. And I remind people, they're like, oh, I've been walking for 30 minutes every day. And I was like, and it still is bothering you, I imagine. And so, yes, if that was enough, it would have been enough.
Yeah.
Yeah.
The how matters.
The how matters, and having that consistent guidance from a licensed clinician is really important. I think that it goes a long way with improving outcomes because you're not kind of just doing your own thing, going on walks for 30 minutes, but then the problem isn't being addressed. You're
Yeah.
having someone who's consistently checking in with you.
Yeah.
A lot of our clients will do lots of check-ins even when we're not seeing them in sessions. We're
Yes.
just checking in on them to see how they're doing. And it can be like a consistent reminder. And know with one-on-one care, if someone's coming in, if they're coming in on a regular weekly cadence and then every other week and then, monthly, whatever, that's still that's consistent enough for them to continue forward with the progress to get
Yes.
long-term effects, which is the goal. We
Yeah.
don't want you to need us forever,
No,
no matter what.
no, come in
Yeah.
and be free.
Yeah.
Yeah. So it's all about giving that education. I mean, for you, Dr. Janvi, how much would you say you give education in your sessions?
All the time. Like I think that's half of it. Like
Yeah.
if someone's doing exercises, like I'm trying to tell them like everything that I can think of, right? Like how much education can I fit into 60 minutes? Like I'm gonna try to fit 90 minutes of education in 60 minutes. Like that's the I think, and the more that like the less scary certain things are, right? Like if I say like, oh, if you do, 100 push-ups, like you're going to be a little sore tomorrow. Then if you wake up sore tomorrow, like that's not scary because like you knew that that was going to happen. This is like yeah, it hurts a little. I'm a little sore, but I knew that. I knew that that was coming. That's not confusing to me. That's not frightening to me. But if I was just like, hey, do 100 push-ups tomorrow, you'll feel better, and you wake up sore, you'd be like, oh my God, like what do I do?
Yeah. I call you because
like
it's
I'm
not
in pain.
Yeah, like something is wrong.
Yeah.
And it's like, no, that's normal. And I think that's I think such like so much of education is like just telling someone like that this is what's gonna happen. Like if you do this, like this is what the outcome will be. So like if this outcome happens to you, like that's expected. Like that's what's gonna happen.
Yes.
Correct. And even I think like dry needling, like you were saying earlier, is something that like I do a lot. And dry needling like helps relax muscles. It's one of the like easiest ways to like if someone has like a really like a lot of pain, a lot of like tightness, like it helps with that. But I mean, at the end of the day, and it does, like that is what it does. But I'm still taking a needle and putting it in your muscle. Like I'm still inserting a needle into your muscle. Will you feel better by the end of the entire like process? Yeah. Is there going to be a little midway point where you're like, this is really sore and this really hurts? Also, yeah. And if I don't tell you about that, you're going to be like, she broke me. But if I do tell you about it, you'll be like, I'm good. This is what's supposed to happen. I'm totally prepared for it. Like, that's okay.
And so knowledge is power. Exactly.
Yeah.
Like taking away, Dr. Saya says all the time, like the scaries, like taking away the scaries.
Yeah, absolutely.
More. Yeah, absolutely. Okay, this has been really wonderful. Tell us a little bit about how people can get in touch with you, and I guess any last burning thoughts that you might have.
I think one of the things that I like to tell like anybody who is like pregnant or trying to get pregnant or like having a baby is like in terms of cadence of like how frequently I think people should come to PT, it's like once in the first, twice in the second, 3 in the third, and 4 in the fourth. That's usually enough time to kind of like keep us going, make sure that we're checking everything out, like our pain is addressed, our body changes are addressed, like all of that is like we're doing good there.
Yeah.
And then if we need more, we do more. But that usually like as a baseline is like enough to kind of make sure that like we're addressing any of the big stuff that like inevitably will pop up as you kind of go through this.
Yeah.
And that's kind of like, those are, if I got to live out all my dreams, those would be my dreams in terms of how frequently people came in.
Yes. The 4 in the fourth, is that talking about postpartum, correct?
The postpartum, yeah.
To know. First trimester, second trimester, third. And then that fourth is what we're talking about. It can be underserved, so I'm glad you mentioned that.
Yes, the fourth trimester is definitely underserved for sure. I like that though. That's awesome. That's awesome. And how can people reach you if they'd like to get in touch?
Yeah, my Instagram is bloom.physical, and then my website is thebloomwellness.com. So
awesome.
Either option. I love receiving little DMs. I love chatting.
Amazing. Okay, well, we will definitely put that in the caption of this podcast. We thank you so much for coming on to this episode.
This was so fun.
Really great. I think we got a lot of information about one-on-one care and talking about that. So thank you so much. We look forward to having you again. In the meantime, stay balanced, mamas.